Hello and welcome everyone. We are really appreciative of you all joining us today and hope to provide you with some additional supports and strategies in caring for people with autism and or other intellectual and developmental disabilities during this new norm of COVID-19. So my name is Kristy Myers and I am a registered nurse and currently supporting the Autism Society of North Carolina with health-related needs across their clinical and programmatic settings. Just a little bit of history. I've been a nurse for 24 years, and 21 of those years have been specifically devoted to supporting people with autism and other intellectual and developmental disabilities, as well as promoting the importance of integrated care. As you probably guessed, my specialty is supporting the physical health needs of people, but with an integrated approach to include behavioral, social, and emotional health in order to achieve whole person health. As you all know, all aspects of health go hand in hand, and each one impacts the other. So without further ado, I'm going to turn you over to my colleague, Louise Southern, who is going to provide an introduction, a review of our objectives, and also a brief overview of some general principles in supporting people with autism spectrum disorder.
Thank you, Kristy. Gosh, I'm so happy to be co-presenting on this topic with Kristy Myers. But my name is Louise Southern, and I'm the Associate Clinical Director for the Autism Society. I've been with the Autism Society for about, I think, 6 or 7 years, and have been working in the field of autism intervention for I'm coming up on 22 years, and I've worked as a public school teacher, an educator, as a clinical professional in a variety of different situations. And we provide a lot of not only clinical consultation on the individual level, but we also in our department, and I am responsible for providing a lot of trainings to external stakeholders, school systems, provider agencies, and other entities across a variety of different topics in the fields of autism intervention and beyond. So I'm really happy to be with you all today. So for these objectives of this webinar, Kristy and I, I'm going to briefly review the core features of autism that inform how we would teach and support adherence to some of these new norms. We're going to identify some of the strategies that we can use to support individuals as they encounter some of these challenging new norms, such as temperature screenings, the 3 W's, so to speak, washing hands, wearing a facial covering, and waiting and maintaining physical distance from others, and COVID-19 testing procedures as well. And then we're going to identify some additional resources for teaching skills and concepts related to these health and safety topics. And again, kind of laid on top of the behavioral strategies and instructional strategies that I'm going to emphasize, I would not have felt comfortable doing this without Kristy's expertise as a healthcare professional. So I'm very happy to be able to provide this collaborative presentation. So yeah, my goodness, you guys, these have been difficult times. Many of you were working hard, whether you're family members, whether you're a self-advocate, or whether you are a professional in this field, you've been working hard to address the challenges associated with autism before COVID-19. And now some of those challenges have likely been exacerbated by the current situation. And many cannot access some of the places that are most calming and preferred. And for many, the predictability and structure that traditional school provided was paused, and caregivers are having to maintain that structure as best they can. And many, with and without autism, certainly feel anxious and isolated right now. And now many individuals with autism, on top of all of this, are encountering additional demands of, for example, of wearing facial coverings, enhanced hygiene routines, adhering to even more stringent guidelines around physical distancing from others, and possible temperature screenings and perhaps even COVID testing procedures in some cases. So before we launch into strategies, I just want to say that, know that you're doing the best that you can in these very difficult times. The aim here is to offer a few autism-informed and medically informed strategies that might make it easier for you and for your child with autism, or the individual with autism. I encourage you, as we present this content, to not be overwhelmed by the strategies, but rather just pick one area, one thing that you're going to focus on first, and then add from there. And don't try to do everything all at once. Certainly none of us can do that, even in the best of circumstances. So as we think about teaching these rules in this new norm, we have to, of course, that our approach has to be informed by an understanding of autism spectrum disorder. And many of you all are living and breathing autism every day. And so for some of you, this is going to be a quick review. And for others, maybe who are working as professionals, this might provide a little bit more helpful insight on how to address some of these challenges and teach these norms through the lens of autism spectrum disorder. And so this all requires perspective taking on our part as we try to support folks in adhering to these norms. When we think about some of the core differences that we see in some with autism spectrum disorder, for example, we see communication differences. And as it pertains to this issue of COVID-19 and new rules that folks have to follow, communication is obviously a core area of difference in many people with autism. And that involves, for example, following directions about these rules or expectations, paying attention to and understanding visual cues in stores or in other places that signal rules about, for example, which direction they have to walk down a grocery aisle, or social distance markers on the floor, being able to reference and attend to those, and then follow the rules that those cues are intended to communicate. And for many with autism, their ability to communicate their own wants and needs and confusion and questions about all of these new rules that they are encountering is difficult for some. And so then we think about this from a sensory processing and sensory regulation perspective. And of course, for example, as it pertains to facial coverings, that new feeling of elastic, for example, over the ears and material across the face, and the heat caused by the mask, for example, can be uncomfortable and overstimulating for many. And for those with autism, that's exacerbated in many cases by these sensory processing and regulation differences that they possess. And individuals with autism might be extra sensitive to smell, for example, inside of the mask. So the sensory piece of this is critical as we're trying to address and teach folks to adhere to some of these new rules and norms. And then we think about the differences we see in some with autism as it pertains to social understanding and social rules. Understanding and adhering to social rules that govern behavior is difficult for some with autism. For example, getting close to someone else is perhaps even less socially acceptable than it already was. But for some, this is difficult to understand and follow. Or deciphering the cues and taking the perspective of others within all of these interaction situations where we have to apply and follow these rules can be very difficult for some with autism. And we think about emotional regulation differences, managing the stress of all of this. Many of us are stressed right now. Obviously, this is a super difficult time. But for some with autism who may not be as equipped to cope or deal, may struggle to use calming strategies in difficult situations, or for example, might struggle to say to oneself, it's okay. When I'm out of this place, I'll be able to take this mask off. I'm going to be okay. The end is coming soon. That can be very difficult for someone with autism to use those sorts of coping strategies in difficult situations. And then we think about rigidity and inflexibility in routines. And so, for example, hygiene practices might be different than the individual with autism is accustomed to. And so those are enhanced routines. And that can be a big change for some. Or for example, I didn't have to wear a mask in Target. Why do I have to now? So that can be very difficult. Those changes to routines can be very difficult for some to tolerate and to follow. And then finally, when we think about some of the differences we see as it pertains to sequencing and mentally organizing and anticipating. So for example, when we organize our own behavior, this helps us to first understand, how long am I going to have to wear this mask? And I can sort of walk into a store, and for myself, I can anticipate and know I'm going to have to wear this facial covering for about 30 minutes. I have a sense of what that feels like, and then I can self-regulate and stay calm around that. But for many with autism, we know that is supremely challenging. Or for example, when do temperature screenings happen? How often are they going to occur? At what points in the day? And when is it going to be over? So these are some of the questions we have to answer for individuals with autism, given some of these core differences that we see. So as we work to adhere to and enforce to the best that we can these COVID-19 rules, obviously what should rise to the top is to try to preserve and promote within individuals with autism and disabilities broadly are kind of these three pillars of self-advocacy, of their own understanding and empowerment for the individual with autism. And as it pertains to this particular topic, when we think about self-advocacy, and you'll see strategies that are rooted in these basic principles when we get to the strategy section, but trying as best we can to provide that individual with autism choice as much as we can, and a sense of control and a sense of comfort, giving them a voice in whatever form that voice might come, for them to ask questions, to assert, to protest, to seek clarification around these rules. Again, in whatever voice that individual with autism uses, whether it's vocally or not, what is their way that they can self-advocate and get those basic needs and questions met? And then, of course, promoting their understanding, which can then in turn empower that individual. So helping them to understand, what are the rules? Why do I have to follow these rules? When do I have to follow these rules? For how long do I have to follow these rules? So using strategies that can answer these questions in a way that the individual with autism can understand is really critical when we're trying to address these new norms and these new rules. And so you're going to see this sort of framework again and again as we talk about these strategies, at least from the behavioral and instructional side. The idea of being proactive and planning ahead, preparing the individual in advance as best as you can, using autism-informed strategies, which will show you some examples of those. Being very concrete and clear, very clear. And again, I'm going to show you examples of ways that illustrate the application of being really concrete and very clear. And to support these efforts to be concrete and clear, we can use visual supports to support our instruction, to promote understanding of and adherence to these rules, to start to help break down some of these complex concepts that are inherent within some of these rules that individuals are having to follow in this new norm. And then finally, celebrating success, whether those are big or little, in whatever form those successes come, and reinforcing the behaviors that we want to see. And so we'll talk more. Obviously, you're going to see this illustrated again and again as we go through each section, each new rule that the individual with autism is going to have to try to follow in this new norm. So these are our basic instructional guidelines.
All right. So I will now start taking a look at some of these procedures that we've been talking about, and starting with our COVID-19 screening and why it's important, and utilizing those strategies that Louise has already brought forth to be thinking about as we're going through this more general information and planning and preparing folks and how to best support them moving forward. I think it's really important for folks to understand how the virus spreads, and that it is spread by being in close contact with another person, through respiratory droplets, whether it be from coughing or sneezing. It can even be from having just a general speaking conversation with someone. You would be expelling respiratory secretions that would have those droplets that could spread the virus as well. Those droplets can be inhaled into the lungs and then come in contact with objects or any surface that's surrounding that has the virus on them. So the way the virus transmits leads to the importance of our screening and supporting people and use of personal protective equipment to make sure we're protecting ourselves, also to make sure that we are protecting others as we move through the viral sequence. So screening obviously is important to ensure that people who are entering an environment with others that do not have active symptoms such as a fever, cough, fatigue, muscle or body aches, and there have been multiple other types of symptoms that the CDC has added on to include things like a headache or a sore throat or a runny nose or congestion, new loss of taste or smell. There are many different types of symptoms that we are seeing and continue to be added on as we move through and learn more through studies about the actual COVID virus. So it's really important as we're entering into environments that we're going through a screening process to determine whether or not we may have active symptoms. So that screening, of course, will consist certainly of questions to determine, if a person has symptoms, if they've been exposed to someone who may have symptoms. And that's the easier part, I think, to try to help explain to an individual with autism. However, the temperature screening piece may be a little daunting. This is not something that they're used to. So I think it's really important as we move forward and looking at, really helping the person understand what's going to happen, why is this going to happen, where is this going to happen, how often is this going to happen, is this going to hurt, is this something, are they going to touch me with this, making sure you know the different types of thermometers that may be used so they can at least get exposure to that. They can see it, potentially they could hold it, practice with it, so that they become very familiar with more of a routine as they're entering areas that provide screening, such as your doctor's offices, or if they're going to a programmatic setting in which the screening process will take place. So we'll move on to the next one. I really wanted to just kind of talk a little bit about, there's lots of different thermometers are out there. So you may have something that you use at home, but the doctor's office may use something different, or your program site might use a different type of thermometer. So just to kind of talk about what's out there, and then we'll, as we do that, we'll talk about some general guidelines related to temperature taking. But the first one you can see on your screen in the top left, which is great if you have a young child, you have pacifier thermometers. That may be something that, would be a comfort for a person, and they will actually register a temperature. A lot of these devices can be used up to 5 years of age, so it's something certainly to consider in the home if that helps support the person. There are digital thermometers, which is like your top middle picture, and digital thermometers basically can typically do an oral temperature, they can do a rectal temperature, and they can even do an armpit temperature. So again, reading your manufacturer's instructions on, how to take those temperatures with that device. But again, if that's something you have in your home, practicing with that, allowing the person to hold it and understand how it's going to be used, helping them understand what they'll have to do if they have to lift their tongue to place the probe underneath, or if they're putting it under their arm, that they'll need to keep their arm closed for a few seconds for it to get the temperature, or so forth. So a digital thermometer is widely used. Now, the one to the far right at the top is one of them that we're seeing more and more often, especially at our doctor's offices, and it's a no contact temporal. Really nice in that you don't have that direct contact with the body. You're held it a few inches away from the forehead, and you aim it, and it's able to take that temporal temperature. However, a person with autism who is not seeing this device, who is not aware of this, could be, very concerned about something pointing at them, and what does that mean, and is this going to hurt me, and really helping the person understand what exactly this is going to do. This will not hurt, this will not touch you, and it's going to read your temperature. And also, say mom's taking a child to the doctor, have mom do it first, and let them know mom's going to do it first, watch what they do, and then you can see my temperature. So doing some of that modeling to help them feel more comfortable. We also have in the bottom right, those are also temporal thermometers, but those do have a contact. So basically it's very gently placed at the middle of the forehead. You press a button, it swipes to your hairline and gives you a temperature. So less invasive for sure, but the person would need to understand that that actually does touch them. It's not going to take long, just a few seconds, and let them have an opportunity to hopefully, see the device, hold the device, practice with the device, maybe use it on someone else to make them more comfortable with that. The middle bottom picture is a tympanic thermometer, and that's also called an ear thermometer. For your ear thermometer, basically you place it very gently in the ear canal, It takes just a few seconds to obtain a reading. This may be a device that you have at home. Certainly I have one here in my home, and I find that they're very reliable. But again, this is another type of device that will touch the person, and a person could potentially be very concerned about something going in their ear. So this would be another one to do real small steps and trying to help them become, informed about this type of device, what it does, what it looks like, have access to it, and so forth. And the last one I've listed on here, one more that is available in your bottom left side, there are forehead strips. So it could be something that, a child may be comfortable with, placing it on kind of like a Band-Aid, and then that will also get a temperature reading as well. You may want to be careful. I know maybe folks who like things like Band-Aids, and so once you put it on, they may not want to take it off. But again, it's all about knowing the person that you're caring for, knowing the person that you work with, to determine how to best support them with these different devices, and setting up small steps to work with them so that they become comfortable with them. So now we'll move to just some general guidelines for taking a temperature. One thing that I think that's important to know as you're taking temps is that temperature does change throughout the day. Typically, your temperature is much lower in the morning, and tends to become higher in the later afternoon. And I don't know if you've experienced this yourself, but oftentimes you'll find that a temperature spikes later in the afternoon. So just some general guidelines. For instance, if you're taking a temp in the morning, it may be a little lower than it normally would be later in the afternoon. It's important to point out that your average body temperature is typically 98.6 degrees. And that does vary from person to person, what your baseline temperature is. And I just know from growing up with my sister and I always ran a higher temperature. A normal temperature for me was typically low 99. And, my sister, on the other hand, a normal temperature for her at baseline was typically in the 97s. So oftentimes when I would get sick, my temperature would spike pretty quickly to 101, 102. But however, my sister, she could be really sick, but her temperature's only noting to be like 100.7 or 100.9, So people do have different baselines. So just being aware of that and trying to determine what the baseline is for the person that you're caring for. There are fluctuations in temperature that happen throughout the day, may happen throughout the month, just based on things such as hormonal activity, could be their day-to-day activity, increased physical activity. Obviously, with our current heat wave that we're experiencing right now, you could have a true fluctuation in your temperature just from walking from your car into your house. So it's important to know that these different types of things and activities can influence a temperature. It's always good if you get a reading and it's higher than you think it should be, and you're a little concerned, it's just to give like a 15-minute type cool down, or a person where they're resting, and then just check it another time to see if that made a difference in getting the most accurate temperature. It's also important with your oral thermometers to make sure you're avoiding consuming hot or cold foods or beverages prior to taking the temperature. Obviously, this could alter the correct temperature reading. With the ear, you want to make sure you place it far enough into the ear canal to make sure that you're getting an accurate reading, and also you want to make sure there's not excessive earwax, because that could also cause you to get an inaccurate reading. With the temporal, as I mentioned before, if someone's been outside, they've been physically active, you want to allow a cool down period, a rest period before you take that temperature. And also you want to make sure the forehead is dry. So for instance, if someone has perspiration on their forehead, you want to make sure you wipe that dry with a clean cloth prior to taking that temperature as well. And one very important reminder for any type of temperature device, you always want to make sure that you're disinfecting your thermometer before and after each use to make sure we're protecting everyone. So I'm sorry, go ahead.
No, go, Kristy.
No, I was just going to say for temperature screenings, it's really important to answer those questions in a way that the person with autism can understand. So, really understanding in the whole screening process, why do I have to do this? Why is it important? What will happen to me? Is this something that's going to touch me? Is it going to hurt? I think that's one of the things that, people really, want to know is how's that going to feel? And especially with people who have, sensory types of concerns, it's very important how that's going to feel to their body when it touches them. It's important to know where these are going to happen. So kind of outlining their day and having some pictures or instructions on when we go to the doctor, that's where you're going to have your screenings, they're going to take your temperature. Or when you go to your program setting, before you go in, they're going to want to do this screening and they're going to use this thermometer to take your temperature. Wanting to, how long will it last? Obviously, these temperature screenings don't take very long at all, but it's really important for a person to know, how quickly am I going to get through this? Because if it's uncomfortable for me, I want to know how long it's going to last.
And so answering these questions, again, like Kristy just stated, in a way that the person with autism can understand. And these are some of the main questions you're going to see iteratively presented again and again as we talk about some of the other rules and norms that we are all having to follow in this COVID phase. And so when we think about how do we answer these questions from the perspective of the person with autism, there are many ways to do this. And I'm just going to provide some examples of these ways. Many of you all are probably very familiar with social stories, or more broadly, a body of social narratives. And what social narratives are, they're essentially like individualized short stories that depict a social situation that the individual with autism might encounter. And these social narratives are used to teach communal skills or specific social or behavioral expectations through the use of precise, concrete, and individualized information about specific events that particular individual could find difficult or confusing. And so when the information is presented in this way, this can provide clarity for some with autism and may, for example, prevent further anxiety within the individual with autism. So the social narrative is really targeted and focused around a specific situation or context. You want to try to keep it fairly narrow to that in order to support the individual with autism and understanding how it applies to them. So this is just one example. And many of these are posted on our website, freely available, downloadable PDFs. In some cases, you'll be able to maybe use these with a particular individual as they are. And in other cases, you'll find that you would have to modify some of these social narratives to best fit that individual's level of understanding and also best fit the situations where they're encountering these new rules and new norms. So here's just one quick example. I won't read all of these social narratives to you as we go through them, but I just wanted to review a couple parts. So in some places, as you can see here, such as school programs or camp, the staff will take my temperature. A thermometer is used to make sure I don't have a fever. There are 2 ways to take my temperature. And then it goes on to present using pictures and fairly as concrete language as we could devise for this specific issue, a description of these 2 types of procedures where the temperature is taken. And at the end, you can see here, again, we're kind of restating, these are the 2 ways this will happen. It's going to be okay. Everyone will be proud of me. And so this is what a social narrative can do, is prepare the individual in advance of a situation that they're likely to encounter these procedures. Not just review this social narrative with the individual one time, but rather would review this on a daily basis, or maybe even multiple times a day, in advance of the situation where this expected event is going to happen. Over time, you might be able to fade that social narrative out, of course, but this can be a really helpful visual priming tool or visual preparation tool. And it can take the place of all of the verbally delivered explanations that we sometimes try to give, which for some with autism, those are very difficult to process, and they're particularly hard to process in the midst of kind of increasing anxiety or frustration or confusion. So you could Google search social narratives and you will see a gazillion different examples of these strategies. And in many cases, when I'm making these homemade for particular clients or even for my own children, I will just pull Google images, cut and paste them into a Word document even, write a little story to go with it, and then print it out. So it doesn't have to be super fancy. You use the tools and technology you have at your home to create some of these. So in addition to social narratives, which can kind of prepare the individual for the expectations and define the situation in a way that the individual with autism can understand, in many cases, particularly around temperature screenings, which are likely to be procedures that the person will encounter on maybe a daily basis, if they're going back into a school setting, if they're going back to a camp setting, if they're going to the doctors, to sort of programmatic settings where screenings are going to be very frequent, might even happen multiple times a day. This is one example. Actually, these are two examples of visual schedules. And so these are examples of visual schedules. And what a visual schedule is, basically, it's a breakdown in concrete terms presented in a way that the individual with autism can understand of what's going to happen and in what order. And so for this particular example on the left, dropping off schedule. So I'm going to wait in the car, then I'm going to walk to the door. They're going to do the temperature check, thumbs up, no fever, everything's great. I'm going to go into the school building. I'm going to go into the programmatic building. And so this is a visual tool that we would present to the individual with autism. Hopefully they would be the ones checking these off each day, holding it, using it, referencing it. It's their tool that helps them to understand the expectations, to organize their own behavior, and to have a sense of what's going to happen and in what order. And of course, we all deserve to understand that. And so for individuals with autism, we need to try to design tools that can support them in having that information that they need as well. As you can imagine, a visual schedule can sometimes prevent anxiety and confusion, which can then ultimately lead to problem behavior in a situation like a temperature screening. So and a visual schedule comes in a lot of different forms: picture-based, photo-based, written words, using an electronic format, even on a telephone. There are a lot of different ways to present this information. And obviously you have to think about that particular person with autism and the way in which they'll best understand it. In many cases, I work with the individual with autism themselves to develop this sequence. So they have that power and control, and they were part of the process of writing the list. So then it becomes a little bit more clear to them, and there's more buy-in around it as well. And for some, I italicized some there because this is not necessary for everyone, and this is not always effective for everyone either. But for some, gradual practice, and Kristy pointed to this a little bit as well earlier, or gradual exposure with a lot of reinforcement, lots of praise, lots of social feedback can help in some of these situations. So first, let's just look at the thermometer. You don't have to, it's not going to come near you. You don't have to touch it. And then you can hold the thermometer. Now you get to hold it. And then maybe now you take caregiver's temperature, or as Kristy said, the caregiver models taking their own temperature. So what we're showing is this is just one example of sort of successive approximations or steps, gradual steps of exposure that we might support some individuals with autism in being able to tolerate, so that then they're able to successfully complete those temperature screenings. So it can look a lot of different ways, but this is just one example and in one strategy that might be relevant for some with autism.
Okay, so now we can transition from our screening and temperature taking over to some information regarding mask. And there are lots of different masks out there. You have your surgical mask, you have your cloth mask, you have with or facial coverings, and so it gets confusing. And then, what's the difference? So I wanted to just really expose everybody to some of the different things that are out there. Of course, your surgical mask, which is at your top left picture, is typically what you'll see healthcare providers wearing outside of if they're actually testing for someone or with someone who is symptomatic. But your kind of general medical face mask, and it is made of medical grade materials. But there are also cloth masks and many different cloth masks, and they all vary and to how many layers are present. Do they have different breathable devices? There's just so many. There's personalized face masks. There are masks that have special characters like Spider-Man, one of my favorites. And so, it's really in looking at all these different face coverings, what's going to provide protection, but what is the most comfortable for the person. The facial coverings that I have at the bottom, the bottom of that slide there, like the one on your bottom left, I mean, that can be folded into make a bandana. You can also pull it down to use as making, a nose and mouth covering. It is important to know that if you're using that type of device and you're pulling it up for a period of time or you're pulling it back down, is to try to remember the outside of the mask is what's contaminated. So you want to keep that together. So if you're pulling it down, you want to overlap it so the outside is now on the inside to keep from having that risk of transmission from any active droplets that may be on the outside of the covering. But those are options as well. I found that some of those cloth masks are very comfortable. I found that some are not so comfortable, and some are more difficult to breathe through. And so I think the bottom line is, in trying to support someone with autism, is trying to find what is the most comfortable for them, what is the most tolerable for them, because the most important thing is that we want to have something that covers the nose and mouth to protect the person. And again, as Louise was saying in the beginning, this is going to vary for each person and what they're able to tolerate, and starting in just very basic steps is going to be very important as we move through and talking about, what type of mask is best and best supports the person. And our next slide will show you just a couple of different specialty face coverings. So if someone is hard of hearing, or they may be deaf, or it's just a person really needs to be able to see the mouth and the lips as they're talking. It helps them better process the communication. There are many different examples of these types of devices that will have a clear plastic lining that covers the mouth area so that they are able to visualize a person's lips moving and help them be more comfortable and seeing more of the general face of the person that they're working with. So that's important as well. Now, our next slide is one that, is very important to me. So our main goal, if we're supporting someone to wear a mask, is just to make sure it's covering the mouth and nose. If we can get someone to tolerate something covering the mouth or nose, that's going to do a lot to protect them and to protect others. And so that is our main goal when we're supporting people.
Kristy, I have a question that came through, and I don't have an answer. I don't know if you do, but it's relevant for the right now. It was, do we have any recommendations for people who are sensory seeking and may tend to chew on the mask? Where I've actually seen it's sopping wet, right? It's just kind of hanging on the chin.
Right. Yeah.
Later behaviorally, I'll keep thinking on the behavioral side, but do you know of any on your side of the house, any particular facial coverings that might be more where the individual might be less inclined to do that?
Yeah, I'll have to think on that as well. I know, I don't know. I guess it depends on, is it just that they want to chew on anything that's there, or is it just because this is irritating? For instance, could you practice with different types of, there's so many different types of fabrics. Mm-hmm. Could be that it's one that just is, irritates them. It's just not comfortable to them. So maybe experimenting with some different types of fabrics to see if that makes a difference. And one of the things that you mentioned earlier on, Louise, is about one of the things important is providing good mouth care, because obviously when you have a face covering on, you're really breathing into the mask, you're having, smelling your breath. So if you don't have good mouth care, that could be something that could be, just uncomfortable for someone, and using different types of things to provide mouth care or, using chewing gum if they like that. Another thing is too, I don't know if the person can chew chewing gum, and that's something they enjoy doing, maybe like doing that, making sure they have a piece of gum they can chew on. Maybe they wouldn't chew on the mask. Outside of that, and looking at like your cloth-based mask, of course, if they are chewing on it and it will get wet, and then really you need to rewash it. So making sure you have a number of them to try to, switch out as you work toward trying to resolve some of those concerns. But I can certainly look more into specific types of masks and share what I find.
Yeah, I'm going to keep thinking on it too. And the other thought is, some of those masks have a moisture barrier. Maybe that can help, right? From a safety perspective, Kristy, this is another reason why I'm glad you're on this with me. Obviously some we would provide in a different context, an OT might prescribe, obviously chewy tubes and other strategies that kind of address those oral, motor, and sensory seeking behaviors. And I don't know, safety wise, is it okay? I know it's not as like COVID safe. If they also engaged in a chewy tube, the mask is still on. Is that a possibility? Just from a healthcare perspective, is that just not a good call?
I think one thing that would be helpful is, for instance, if you had one of those specialty masks where you could actually see the person as they're chewing, and also, one of the things that's concerning about masks when it comes to safety is that you're covering areas that you may be able to look at and see if someone's having discomfort. For instance, just like you said, if someone's choking, oftentimes you can look at the face and tell, but when you have that covered with a mask, that takes away that visual and being able to make sure someone is safe. So, and I always err on the side of safety. So it's just, I think it may be something to have an OT look at, make some suggestions. Try it without, try it with, and then, get some input regarding the safety of that and if they feel they're comfortable with moving forward with that type of a mask with something to chew on in addition.
These are good questions. We'll keep focusing on them. Thank you, guys.
Absolutely. Just some additional important tips for wearing a face covering. As I said earlier, it's obviously very important that you're able to breathe comfortably. I've tried cloth masks that have, 6 layers of fabrics, and I just found it almost suffocating. So that's obviously not something that I want to wear. And there's so many out there with so many different types of layers and filters and so forth. But making sure you can breathe comfortably is one of the most important factors. Making sure it fits comfortably. You don't want it too loose, it's falling off. You certainly don't want it too tight. Again, ensuring that it is covering the mouth and nose. Making sure, of course, that you're wearing it whenever you're going out in public and in close contact with others. One of the things that we've noticed, especially in implementing with staff who are mandated to wear masks while they are working with people, is that folks have communicated that they've had skin irritation and or breakdown behind the ears from those straps of your mask. So it's really important to monitor those areas, because behind the ear, oftentimes it's hard to determine until it gets really bad. So just kind of maybe doing a daily inspection to look at that. There are other options for being able to place those straps. There are devices you can buy in which the straps will connect to a device that's on the back of your head, keeping it from going around the ears. People have gotten incredibly creative by putting buttons on bandanas and hooking them to those, or ball caps. And there are just a lot of different creative ways to get around that issue if it becomes that. But obviously making sure it's a good fit, not too tight, not too loose. And so we also, for the next slide, just a few more continued tips. When you're removing a mask or any type of personal protective equipment, you want to make sure you're removing it slowly. If you've been in an environment where you're around others and you could potentially have droplets that are on the outside of your mask, If you remove it quickly, you can often disrupt those droplets, and then they're back in the air, or they're transmitting elsewhere. So we want to do it really carefully. If it's a mask that you're going to store, you want to store it in a paper bag in between use. And also, making sure that you're folding, as I said, the outside of the mask together to try to keep that contaminated side of the mask together as you store it prior to the next use. You do want to store your mask in a bag or a bin until they can be laundered. If it's disposable, then you want to replace the covering after each use, or at least daily based on supply. Right now, we have gotten to a place where we are much more easily able to get supplies. That could certainly change as COVID and cases increase. So it's something we certainly need to keep our eye out for. But in the beginning, we really were limited on supplies, and we were having to reuse a lot of things. So that will, that could change in the future. But right now, we've been very fortunate in our state working toward, getting us the supplies that we need. But for storing, make sure they're stored until you can launder them. If you are going to wash, like if you're using a face mask in which you wash, you want to make sure you wash it at least daily. You really want to do it after wearing, but at least daily. The recommendations are to machine wash with regular laundry detergent at the warmest appropriate water setting for cloth, for that particular cloth that you're using, and to dry it in the dryer using the highest heat setting. I do want folks to know that there are on the CDC website guidelines for washing them by hand, as well as drying them by leaving them out. So you can also look at those. It does involve mixing a bleach solution in which you want to soak that mask for 5 minutes prior to allowing it to dry, and they do recommend that if you can place it out in direct sunlight, that is helpful as well. But just want to make sure folks know the CDC has a great website that talks about how to wash your face mask. So please refer to that, or ask us any other questions that you have as far as that goes. And then the last thing is to make sure you always wash your hands after the removal of the mask, because it's really hard to not have your hands come in contact with any contamination. We do, recommend people remove them by the straps very slowly, fold it in on themselves, put it in a bin, but there's no way you're not going to get some contamination on your hands. So always make sure that you wash your hands really well after you remove those masks. I do want to mention a couple of contraindications and or some exceptions that you may have heard of when we had our last executive order that came out regarding wearing masks in public spaces. So a contraindication for sure is that you never want to place a face covering on a child that's under 2 years old because of the risk of suffocation. So that's very important. There may be medical or behavioral conditions or a disability in which a mask would be contraindicated. So it's really important to always confer with your healthcare provider on whether that's safe or not. One of the guidelines for people to, maybe not wear a mask is if you have a condition such as a moderate to severe asthma. Well, say your child has mild asthma. I just think it's a best to contact your healthcare provider, make sure you know any risks that may be associated with that, and always go by your healthcare provider's guidance regarding that. As far as the executive order, there was also an exception listed for children under 11 years old. I think it's really important to do our best to try to protect everybody, but just know that is an exception there. Obviously, you will have an exception if you're actively eating or drinking, and you may have noticed that if you do go to a restaurant now, they will require that you keep your mask on while you're seated, while you're ordering, you're waiting for your food, and then you can remove your mask for eating and drinking. And then once you're done, then you put your mask back on. So that's another one. Strenuous exercise is another one that is an exception, because if you're doing real strenuous exercise, you've got a high heart rate, your respiratory rate is up. It may very well not be safe to wear a face covering during those times. If you are unable to place the face covering on a child safely, that would be another exception to not wear a mask. And just remember, with those exceptions that were listed in the executive order, you do not have to have proof or documentation. That is not required for, not wearing a mask in those exception areas. All right, so I'll switch it back over to Louise.
Yeah. Thank you, Kristy. Yeah. The challenge, these challenges, of course, we've talked about some of the core features of autism at the beginning. I laid out some of those main core features, but when we think about some of the challenges specific to wearing a facial covering or a mask, obviously, and this is not just true for autism, of course, but even though there is no actual risk of the mask preventing breathing, of course, except in individuals under age 2 or other health conditions, as Kristy pointed out, since there's no actual risk of wearing a mask preventing breathing for most people, wearing a mask, though, can still make it feel like your airflow is being restricted. And so for some individuals with autism, of course, this can cause increased feelings of anxiety. We also know that wearing a mask impacts social communication interactions, and we feel that ourselves. I'm sure we all do. It's awkward. We're having to read eyes and body language even more carefully. But that's exactly a challenge of many individuals with autism, is reading the eyes, the non-vocal cues, those gestures and body language and tone of voice that signal what the individual is communicating. And that can be really challenging and even make it more confusing for the individual with autism to socially interact in a variety of different situations. Of course, from a sensory perspective, we've touched on this. This is a critical consideration. We're talking about facial coverings and masks. And then, wearing a mask can also reduce peripheral vision, as I've experienced myself, and that can be distracting when looking down. And particularly for some with autism, that can maybe be even more distracting or disorienting or frustrating. And that can be hard for individuals with autism who may struggle to block out extraneous sensory information already. And so the mask therefore makes that even more difficult. And then finally, from sort of an oral and facial motor perspective, that one person who's already asked a question about that, the individual who's sensory seeking, who was chewing on the mask, we recognize that is a big challenge for some with autism and other disabilities. And those who have oral or facial motor planning issues, of course, this can also impact their communication or their ability to produce language, particularly for those individuals with autism who are working on language production and articulation, for example. This can make that even more challenging to address. So the challenges are clear here, and I know many of you all, again, are living this every day. This is not a news flash to you, but the reason I wanted to put this slide in here is because we do have a lot of professionals in this audience as well, and obviously some of you professionals have tremendous experience with autism, but some of you may be newer to autism, and so we want to make sure we're emphasizing the ways in which these core features can impact these issues. And so when we design strategies, we have to look at this through the autism lens. And we know that for some with autism, thematic approaches can help. And this is, of course, not going to work for everybody. I completely recognize this. These thematic approaches obviously also work for some younger children who do not have autism. But as it pertains to autism, we can see that sometimes we've had success when a favorite stuffed animal or doll or vehicle or train even wears a little, made up, mask. We pretend to make a mask out of even tissue paper, and we put it in Thomas the Train is wearing a mask. You can wear a mask too. Let's play that together. So really recruiting those special interests, those areas of focus that we see in many people with autism, particularly if they're thematic in this way, it can be helpful to sometimes engineer our instruction around wearing a facial covering and using some of these interests, or pretend play concepts like, let's pretend to be a nurse or doctor. We're going to go in the grocery store. I'm going to be a nurse and you're going to be a nurse. or we're going to be superheroes who wear masks. And of course, you know, whenever feasible, and I know this isn't always possible from a resources perspective and otherwise, but if we can provide the individual with autism with choice, preferred themes, what kind of colors, what fabrics, you know, there are also scents that can be included in some of these masks. So considering some of these aspects might help some with autism to be more inclined to buy into this requirement. And again, we're coming back to this over and over, answering these questions in a way that the individual with autism can understand. Why do I have to wear facial coverings? For many, we need to answer this question in a way that's understandable and concrete for the individual with autism. How do I wear it? When do I have to wear it? When can I take it off? And for how long do I have to wear it? So as we're addressing and trying to teach this to folks with autism, whether you're supporting an individual at home as the caregiver, whether you're an educator who's about to be presented with this challenge in the new school year, regardless of where you're working with folks with autism, how are we going to answer these questions in a way they can understand it? And again, I'm going to point us back to a lot of the tried and true visual supports and behavioral strategies that can give us some of the possible answers to this. So again, a social narrative. I talked about what social narratives are already, so I'm not going to belabor the point. This is one example from our Autism Society of North Carolina website. It's available on our website, freely downloadable, printed out. There are many examples of social narratives specific to mask wearing in this new age, and you can Google search and get examples of those. And then by getting those examples, it might help you to better individually tailor it for the person who you are supporting. Because as you can see here, for one person with autism, this social narrative is just right. It's just the right amount of information at the level of complexity that they can understand it, using the pictures that are relevant to them. But for another person with autism, this won't be as relevant or meaningful. So we have to design it with that in mind. And again, you use these social narratives in a preparation way. You prepare them or prime them in advance of having to wear the mask. You review it, maybe each day, maybe several times a day. In a school-based setting, educators are likely going to have to review these expectations and use strategies like this to support some students with autism in tolerating these facial coverings. Here's another one we designed because we found that for some folks with autism, they're pulling the mask off of us because why is my person wearing a mask? And so we wanted to try to provide an example of a way to explain this in a way that the person with autism might understand it. So this is one that's about people around me are wearing masks, and it indicates what are the rules and expectations, and that it might be strange for them to wear a mask, but they are still able to talk to me, and only they can take it off and only they put it on. So we're trying to convey some of the rules and expectations in a way that some people with autism might be able to better understand it. Again, these are just examples for you, but these are all resources we want to provide to you on our website. So I gave you two examples of social narratives, and now I'm showing you some condensed and refined versions. And so these are more simplified or adjusted examples, even more individually tailored. So the one you can see on the left here is I tried to really cut down the language or the written language that's used. Masks keep me safer. I wear a mask in stores and restaurants. This is the rule. So for some who may be sort of rule followers but need this information presented in visual and concrete terms, with a visual image that depicts someone who looks like them, it's important that it looks like them, wearing a mask. This might be one helpful visual cue, and this is something you're going to present and show a number of times across a day, even in advance of walking into the store, in advance of going into a school setting or wherever is relevant for that person. On the right, you can see here, this is designed for a person with autism who loves Justin Bieber. And so obviously this is really using those thematic areas of focus to recruit engagement, to get buy-in from the person with autism. And so if you Google search power card strategies, this is pulling from that body of work. These are also social stories, but they're modified. And so Justin is my favorite singer. Justin is wearing a mask in public. He wears it to be safer, and so I can do it too. So the idea here is just to recruit that interest and that buy-in. This is not going to work for everybody with autism, but for some, these can be effective strategies to consider. And again, there's nothing fancy about this. I just use a Microsoft document, type some text, cut and paste images that I take from Google, And for some, that can be the way to design these at home. Even more condensed, even more modified might be just a visual cue, maybe of that individual themselves wearing a mask. A picture cue, for example, that shows and indicates time to put mask on. For some, obviously, the object of the mask itself can communicate that. I'm going to put my mask on as the caregiver. It's time to wear a mask. So visually signaling it in a way that the individual with autism can understand, and using very concrete language for some is going to be really important. So not a whole bunch of this, but rather what is the most meaningful, relevant information that that person needs to hear and to see in that moment in advance of walking into wherever they have to walk into. Here's another, this is a first then schedule. So first mask in store, then mask off in car. So it's kind of like that old tried and true, first eat your vegetables, then get dessert. So we're using that example and putting it into the context of COVID and wearing masks. So first then, obviously this is where when you're walking through a store, this might be the time where you're having to show that first then schedule on your phone, if you've printed it out, however you've designed that first then schedule, reminding the person of the expectations and that the end is coming. When you get it to the car, you will be able to take the mask off. For some, they can understand that information verbally, but for some with autism, when we rely too much on verbal information, we're losing their understanding in the process. And so that's why visual supports can be helpful there. Here's another quick example, visual countdown strips. I've seen a number of individuals use these. So this is where you basically have a laminated strip and you're using Velcro slots and you're placing Velcro in each one of these rectangles and you're laminating these little pictures of the boy wearing a mask. And at first, when you walk in the store, this strip is loaded up with these pictures of the boy wearing the mask. And as you move through the store and as you're getting closer to being done, you're able to visually signal for that person with autism as you remove each one of those little cues. The mask, it's getting closer. We're getting closer to the time where you get to take your mask off. Because for some, a visual timer is not effective. Maybe the concept of time is not clear. And so this is another way that you could consider visually depicting how much and how long do I have to wear the mask and when do I get to take it off. Here's yet another example. These are visual schedules. And so, for example, if I'm the caregiver and I'm going out in the community with my child or the adult with autism, I'm going to show them what's going to happen and in what order. We're going to go to Target. And yes, by the way, remember, we're going to have to wear a mask there. We're going to pick up lunch. And yes, by the way, we're going to have to wear a mask there. We're going to the Fort Mill Park. You don't have to wear a mask in the outdoor park. You're showing them that. You're conveying that to them. And then home, no mask. So you're concretely breaking down what's going to happen and in what order. And obviously, this is an evidence-based strategy that we would be using for lots of individuals with autism outside of the context of COVID. It's just that these can have a lot of utility when we're trying to support people with autism during COVID as well. You can see other examples of visual schedules here. It's going to look really different for each person, but I encourage caregivers and professionals to consider how they can engineer these tools to communicate some of these expectations to individuals with autism. Over here on the right, you can see a very simple example, a written shopping list even. The shopping list is going to include, first thing on the list is mask on. Then we're going to get the cereal, the bars, the rice, the pasta, whatever. And at the end of that list, you're writing down outside. When we get outside, we take the mask off. Obviously, in a perfect world, the person with autism is helping to write this list or helping to design it in some way, shape, or form. And then they're the ones marking off, checking off, removing, physically interacting with the schedule or the list can be helpful to them in being able to pay attention to it and to understand it more effectively. When we're thinking about from sort of a behavioral and teaching perspective of how do we support a person with autism in tolerating mask wearing, obviously for some, it's a ridiculous expectation to think they're going to wear it across an entire day, for example, or even across an entire grocery store outing. And so what are some considerations that we could apply for starting with shorter durations maybe? Lower demand settings might be a place to consider. So for example, maybe our initial goal is when we're entering and exiting program areas. That's when you got to wear it. When you're in those major hallways where there are lots of other people, maybe that's an area where the leadership or administrators within that building will allow us to work on it there first before we're having to wear it all day long. I know that's going to be very specific to that site, and the leadership is going to make those decisions, but these are just some examples to consider. Or of course, if you're a caregiver and you're going out in the community with an individual, go at those off-peak times and make the outings briefer. You know, don't go to Target on a Saturday morning, mid-morning, when it's very crowded there and planning to go for a long time, but maybe start at those off-peak hours, walking into Target, getting 2 things. They wear the mask for that period, and then there's success, and we can celebrate that, and we get to leave. So trying to think about ways to engineer your outings, if we're having to systematically approach this issue, these are some things to consider. These are things to consider not just for caregivers, I have to say again, for service providers and other professionals who are supporting individuals with autism and thinking this through. And consider, for example, going and practicing these skills in retail environments that are going to be a little bit more forgiving. Some retail environments are allowing and honoring exemptions, and we are hearing that some are not. And so, you know, doing our homework and figuring out where are the places that are going to be really strict on this policy, and where are the ones that are going to be a little bit more understanding as we're trying to teach and address this skill. And again, just like with temperature screenings, for some people with autism, gradual practice with lots of reinforcement can help. So starting, and this is just one example, and again, this is not going to be relevant or understandable to everybody with autism, but starting with systematically holding the mask, then bringing it to their face the next time we practice it. And then a few times after that, we're practicing it touching their face briefly. And then the next time we're practicing it fitting over one ear, and then over the next, systematically across days or across practice sessions. We're gradually, systematically building up to the point where then they're wearing it. And then we're gradually increasing the time in which they're required to keep it on. So for some, we can have success, but it's going to take some painfully gradual practice. And when we're out in the community or wherever we are and the individual with autism is required to wear a facial covering in that setting, for example, of course, distractions might help some, and those distractions have got to be individually determined. What works for some is not going to work for everybody. So what might redirect their focus? What might keep them calm and cool when it's really difficult? You're going to know that best as the caregiver or professional working with that individual to decide what might help keep that mask on. And obviously for some too, think about how we can reinforce the behavior of mask wearing. So maybe in some cases, you might be doling out opportunities for him or her to access the iPad as you're out in the community because he's keeping his mask on. Great job wearing your mask. Here's your iPad again. For others, maybe you're able to present it in a way that after we get out of Target, as soon as we get out of the store, you get to use my phone because you are keeping your mask on. So also thinking about how you can arrange some of those reinforcers. And obviously lots of social praise, lots of positive enthusiasm and supporting the individual in wearing it for any amount of time is important to consider. So again, we presented these basic guidelines at the beginning of this webinar: being proactive, being concrete and clear, using visual supports to provide a lot of that clarity, and then celebrating successes wherever we see them. I want to say here too that wearing a mask, we understand that for some, we're not going to get to the point where they're going to tolerate and wear a facial covering for any amount of time at all. And we recognize that, and we know that as well. And so in those cases, you know, celebrate even the tiny successes where you have them, and just be forgiving of yourself and the individual with autism. This is not going to work for everybody, and we do know that. But these are some of the tried and true strategies to attempt. So here too, physical distancing, you know, keeping 6 feet apart. What in the world does 6 feet mean and look like for some with autism? So trying to answer these questions in a way that the person can understand. Why do I have to do this? What does it mean or look like? And when do I have to do it? How can we answer these questions in the way the person will understand? And how can we prepare them for those expectations? We've got a lot of examples of social narratives up on our website and on other resources that can define what social distancing means in a way that might be more understandable to some with autism. So here's another example from our website. You're going to get these handouts, of course, so you can reference this. And obviously, we encourage you to go to our social narratives webpage and our COVID-19 webpage, and you can download a lot of these resources. We're not the only ones, of course, offering these free resources. So I encourage you to take a look at what's out there. Here's another example of a social narrative, specifically trying to define what 6 feet means and looks like. And so 6 feet, for example, is as long as some couches. 6 feet is as tall as a refrigerator. So defining that in a way that the person with autism might understand better can be helpful to some. And then obviously, in conjunction with using this visual strategy of a social narrative to define what 6 feet means and looks like, it's also going to be important to practice it for some. You stand here, I stand there. This is 6 feet. You stand here, I stand here. This is 6 feet. To help orient them through practice and role play and modeling, this is what 6 feet feels and looks like. And for some, those visual strategies might be too complex. And so we might need to simplify and adjust our language and our expectations and be consistent in our rules. So for some, we're not going to define what 6 feet distance from another person means, but rather we're going to support that individual with autism in understanding, stay close to me in the store, stay beside me in the store. And this is one example of a visual cue, a visual rule that we might use and present in conjunction with some basic verbal language, verbal rules. Stay close, stay beside me, that we can present and remind that person with autism of the expectations for. So there's just a lot of different ways to consider using visual supports. It's just that we have to modify them to best meet the level of understanding of that person. And building routines around this is important. A quick another example, this is a social story that I wrote for a specific child with autism, where he was inclined to get in other people's space at the park, which in another day and age would have been obviously not okay to be right up close, but we could get closer to one another, climbing up the ladder, waiting in line behind at the slide. And now we're having to increase that distance. And that can be really confusing for a lot of individuals with autism. And so at the park, here are my 6 feet rules. And so you can see here an example, 1 at a time on the monkey bars, way at the top of the slide. I can have races, but I can't touch other people. Hands and feet to myself, and I can do it. So again, you're going to design some of these social narratives specific to that person and their level of understanding. And you're not just going to read this to the person or read this with them or have them read it once, but rather you're going to review this again and again to help prepare them for the expectations and then reviewing these expectations in a way that's understandable to them. As I've already said, role play and practice is going to be really important for some with autism. Modeling and showing what 6 feet looks and feels like. There's a lot of YouTube, a lot of pictures and YouTube videos out there. An increasing number of those are being produced that are helping to define this for children and also for individuals with disabilities. And then in some cases, using scenarios and role-playing scenarios to address some of the increasingly complex social situations that you might encounter. And helping the individual to problem solve for those who can access and kind of participate in more role play and problem solving and discussion-based formats around how to handle certain situations. It's going to be important to present some of those scenario-based situations so that you can help support that person with autism and problem solving around it and working through what's the right or expected behavior versus what might be the less expected or inappropriate response in that situation. Kristy,
All right.
on hand washing.
So I will talk a little bit about hand washing, which obviously is so incredibly important to help keep us safe, help work with others to help keep them safe. I'm going to just kind of go over some basic guidelines for what we want to do with hand washing, and then we can kind of look at how are some ways we can support people and, conforming to those rules and guidelines. So obviously with your hand washing, you really want to do that after activities, before and after meals and snacks, after coughing or sneezing, after using the bathroom, and basically anytime your hands get dirty or contaminated, which is a lot. Your typical guidelines for hand washing are to wash them for 20 seconds, making sure you're interlacing the fingers. You're wanting to cover all your hand surfaces, even up to the wrist, working around nail beds and under the nails, which is where a lot of your germs and viruses like to hide and stick to you. You want to rinse under running water with your hands in a downward position to just wash those germs, those droplets off of your hands and into the sink. It's recommended you dry with a paper towel and then use that paper towel to turn the faucet off. Again, trying to not contaminate after you have done your hand washing. There's also hand sanitizer. And so thinking about when should I use hand sanitizer versus washing my hands. But basically, your hand sanitizer should be used anytime when you don't have a hand washing sink available. So oftentimes, in the car, if I'm going to the grocery store, I'm going to the pharmacy, and I'm getting back, in my car, I want to have something to wash my hands with, but I don't have a hand washing sink available. You can certainly use a hand sanitizer, but it's important to know that the guidelines for hand sanitizer is basically the same as washing your hands with soap and water. You want to wash them for 20 seconds. You want to interlace your fingers, cover all your hand surfaces, work around those nail beds and under the nails, and then allow them to air dry. So just these are your general principles. Now, obviously, this is a tough thing to be able to work to support someone with autism to go through all these steps and help them understand the need for all these different things. So, having to really set up very specific concrete steps, working steps to just, let's get this down first, and then we'll move to the next small step. And so over time, in your program or in your training, that you're working toward how to really do good hand washing. I know some people really, really love the water. So hand washing is actually something that's, somewhat enforcing sometimes for them. They may want a particular water temperature that makes them feel most comfortable. So looking at those types of things. They may respond well to like a hand, like doing it themselves, but maybe some hand over hand to help them really, get their hands clean. There are lots of opportunities to support people with the hand washing process. But I think a key is however we can try to, teach people the importance of washing hands and when we want to wash hands. Is very important. I did want to just mention a few things about nails just for your general information. It's really important to keep your nails short, no more than 1/4 of an inch. As I said, the germs like to hide around those nail beds and underneath the nails. And it's also important to keep them nicely trimmed and filed so that you don't have jagged edges. That'll help, avoid some of that additional virus or bacteria that could be on those nails. So be thinking about that with people and having to work with them to keep those nails trimmed and filed. And it's also contraindicated for wearing nails that are like, say, gel or of another type of nature, just because they do add a much higher level of bacteria and viral deposits under those. So just wanted to mention those things.
Trying to advance the slide here. There we go. Okay.
So this is another narrative that is supplied by the Autism Society of North Carolina on their website, but it talks about specifically, I have to wash my hands a lot. And so trying to go through and give them specific pictures or steps and to why is this important? Why do I have to do this? How long does this last? Oftentimes you hear people advising singing the ABC song to help with that 20-second rule. But the person may have a favorite song that they love to sing. So, you just have them utilize whatever is most comforting and supportive for them. So the last part we're going to really hit is the COVID-19 testing. And I feel like this is really important because this can be very, very difficult. Just for your general knowledge, there are different types of testing. I'm sure you've heard of antibody testing. And antibody testing is done to determine if you've had the virus before. I think it's important to note that we don't yet know if having antibodies to the virus will protect someone from getting it again. And if they do, how long does that protection last? So there's just a lot of unknowns about that. That is a blood test that is done. But what we'll really want to focus on is the viral testing. And your viral testing is a diagnostic test to determine if you do have confirmed COVID-19. There are different ways that this test can be performed. The most common and most reliable is going to be your nasopharyngeal swab. So that's why we will focus more on that particular one. They do have other testings that you can do, which are called an oropharyngeal swab, which is in the mouth and throat. There is just a nasal swab, which basically you take a swab and you'll swab the mid or front of the nostrils. They also have what's called a home saliva test, and which goes to your home. You submit a sample of saliva, you put it back in a kit, and you send it in for testing. We certainly don't know anything really about the reliability of that. I don't think that's something to see, but it's just something I wanted to mention that is out there in case you hear about it. So for COVID-19, we are going to go ahead and really focus on this nasopharyngeal swab test. It's basically the most reliable test. It's what people are basically going to be using if, in fact, you have to support someone and going to get a test. And what this will involve is you'll have a trained professional, and they're going to use a long swab it's a cotton tip swab, typically about 6 inches. And what they will do is insert that nasal swab, and you can kind of see the picture there, into both sides of the nose, and they're going to move it around for up to 15 seconds. So I'm sure that you can imagine that for a person with autism, this could be incredibly difficult and cause immense anxiety. So we're going to just talk about some things that we can do to help support that person if we need to get that test done. I think it's important to let them know that it will not hurt, that it may be uncomfortable. It will typically cause their eyes to water. It may cause coughing or sneezing when they place the swab into the nose. And at times, it also can stimulate the gag reflex. So those are some important things for you to know. And also, in working with a person with autism, determine how can I support them? What information is important to give them without causing additional anxiety about the test. And that is going to be different from one person to the next. So that's kind of what to expect when you go. I wanted to talk a bit about testing sites just because there are many different testing sites. They have what are called pop-up testing sites. These are typically like for a single or multi-day testing event. So say there has been a business or an area that has had an exposure and they're really wanting to test a large group of people just to see if they've been exposed or tested positive. So these are located on the site. Well, at the bottom, as you can see, our Department of Health and Human Services does have a link in which you can go to find my testing site. And so they'll be listed as a pop-up testing site and for how long they are going to be open. Other testing sites could be your healthcare provider office, an urgent care clinic, a drive-through, a hospital, or an independent laboratory, such as Walgreens or CVS. One of the things I really want to focus on here is to be thinking about the person that you care for. And out of these testing sites, what do you feel like would be the most supportive for them? For example, they may have a great rapport with their primary care physician and or the nurse that works with them at their primary care physician. They have a familiar face, they have a familiar voice, and so that may be the best place to work with and going to get a test if that's indicated. On the other hand, you may have someone that we can get them into the car pretty easily, but getting them out of the car is just not going to happen. And so there you may find that the drive-through testing would be the most supportive place. Another thing that I think can be really scary for people, so even if they're going to their healthcare provider and they know their face and they know their voice and they know they typically wear a lab jacket or they wear scrubs, people are going to look a lot different when people go in to get testing. They're not going to look the same. So preparing people that they're going to be wearing different types of clothing and things to, help keep them safe. They may be wearing gowns and they'll be wearing masks and they'll be wearing face shields and they may be wearing a hair cover, all sorts of PPE, foot covers. So having some representation, a picture to show them, explaining why this person is going to be wearing this type of garb, because just to go in and see that and not be prepared, they're probably going to think there's a space alien that's coming at them with this long swab. So we want to make sure to do everything we can to support them, prepare them for what this experience is going to look like. How long is it going to take? Is it going to hurt me? So many different pieces. And again, the different supports and social narratives and practice steps, as we've talked about ongoing related to the COVID procedures. This one is a really important one. And it's also important that you be as prepared as possible, because this isn't something that, you find out tomorrow that, oh my goodness, we've got to go get tested. So it's just something to be thinking about, to go ahead and set up that preparation before, to make this a less difficult experience for the people you're supporting. So some COVID-19 swab test guidelines for caregivers. Again, it's always important to communicate with your medical provider in advance if possible. You may have a setup where, you have a person who does well as long as they don't have to wait. So making sure that, you get an appointment where they can just be taken right in, the procedure gets done, they can leave, versus if they have to sit there for 20 minutes, there will be a complete meltdown and we won't, be able to process the test. So making sure you call, making sure that they can accommodate you, making sure that they know, I'm bringing my child who needs to be tested, but she does have a diagnosis of autism spectrum disorder. A lot of your sites now, and especially your drive-throughs, they'll have people that are specially trained to work with people with intellectual and developmental disabilities as well as autism. So that, letting them know that you're bringing someone, and do you have someone specialized that can help support them? Making sure that they're prepared again about the protective equipment that's going to be worn by professionals. Where are we going? When are we going? Where are we going? What's going to happen? Why are we doing this? Making sure again to make sure you have any of their preferred items, distractions, reinforcers. Making sure to bring visual supports like your social narratives, maybe a timer or a schedule to show, first test, and then, we'll get my preferred item, or, test, or we'll get this reinforcement. I think, again, just continuing with the concepts that Louise has been speaking of this afternoon, making sure that you stay calm, because it's difficult. If you have a loved one that you're taking for procedure and they're upset, it's very difficult to keep calm yourself, and always maintain that positive communication. Very soothing voice will help keep them calm as well.
Kristy, I have a question to ask before we move on, because obviously we want to try all of these preventative strategies that you just laid out as it pertains to COVID testing. Those have to be what we consider first and foremost. But we have a question for when those strategies fail. The individual, must be tested, and perhaps they're highly aggressive. Are there, to your knowledge, are there options? What are the options in those really challenging, unfortunate situations?
So I think that, oftentimes it's going to be up to the provider. I mean, I've had situations in which someone's really needed something and this is not going well. And let's take a break. Let's try to retort it and maybe retry again. I've heard of situations in which there's multiple people in a drive-through that are, coming through the car, and maybe the caregivers, supporting the person in a position to where they're able to go ahead and get it done. I think much like immunization, those are difficult as well. They're difficult for anyone, but particularly for a person with autism spectrum disorder. And so trying
like
to
dental procedures, right? Like comparable to dental procedures. So
yeah. Right. And I think, really just, again, that working with them before will help the most. And this is, how long is this going to take, and, really giving them reinforcement about, education, but reinforcement post-procedure. Sometimes it's easier to try to, help contain them and go ahead and get the test done. Sometimes you just need to, okay, let's take a break. This isn't helping, the person and making a decision. I think that's going to depend up to the caregiver and the provider. And asking too, okay, this isn't going well, or there's some additional supports. Is there a different environment that, we can be more successful? It's a tough one.
Mm-hmm. Yeah, it is tough. And we're hearing some, difficult stories about this. So
yes, I've heard of some very difficult ones. And that's one of the reasons I wanted to bring it up today as part of our presentation, is to have people really thinking about this and trying to kind of prepare in advance, because the likelihood that someone's going to have to go get tested is fairly high. The better prepared we can be, I think the more support it will provide for the person and the ability to get the test completed.
So I know we're over our time. I'm like notorious for this. So I thought for sure this will not be the day where this happens. And apparently it is the day where this is happening. A gazillion attendees. But and we are at the end anyway. However, there's a couple of things we want to emphasize before we wrap up. Obviously, as with all of the other new norms and rules that individuals are having to encounter right now, answering these questions to the extent that we can in a way that the individuals with autism can understand them is critical. And Kristy already pointed to social narratives. There are many out there, and there's a growing body of them, and we're going to be producing some at the Autism Society around COVID testing, supporting that individual with autism using visual supports to help them understand what's going to happen in a way that they might be able to better understand it. This is but one example from Massachusetts General that's freely available. They have a nice packet actually of COVID-19 preparation tools for individuals with autism and other disabilities. Here's a nice example from the Teach Autism program. And they have many other strategies related to COVID that they have posted on their site. This is just another example of visual schedule. Shows what's going to happen and in what order. And there goes Chick-fil-A at the end. That's the thing I can look forward to when this very difficult procedure is over with. So again, taking away these major guidelines as caregivers and as professionals of where it makes sense to be proactive and plan ahead and prepare the individual as best you can. Being very concrete and clear, though, in your preparation strategies. And in doing so, that often involves the use of visual supports to augment all of that verbal communication you're trying to deliver, instructions, explanations. For many folks, that's not going to be understandable. And so we can support that information visually in many cases. And then celebrating the baby steps. We recognize that for many, this is incremental progress that might take a long time. For some, this is going to be very difficult to achieve. And that's okay too. But celebrating those successes where you have them and taking it one step at a time and taking care of yourself, all of you, and as you take care of that individual with autism. Yeah. So just to wrap up, there's a COVID-19 webpage, the Autism Society. It is ever growing. We are offering a number of resources there, and it's growing all the time. We are all coming up. There's going to be a lot of this, I think, but at least I know of in July and August, we have blogs that are dedicated to the issue of reopening schools. We also have several live webinars that are coming up in July and August. We encourage you to go to our Autism Society website for information about those live webinars. But for example, we have one on July 28th on the IEP process in changing times. So that might be one that's interesting to you, and you can go to our website to learn more about that. We also have one coming up on August 27th, for example, that's focused on navigating the challenges of online learning and telehealth through collaborative problem solving. So we at the Autism Society, our autism resource specialists and our clinical department, we fully acknowledge what a challenge this is going to be. And our departments are working hard to try to identify and support you along the way in this unprecedented time. We also have a number of other free webinars. They're recorded, they're freely available to you. We have a number of topics related to COVID and a wide variety of other autism relevant topics that we encourage you to explore. Social Narratives webpage, of course, that's a growing library that we are producing relevant narratives on timely topics, whether those topics be related to COVID-19, whether they be related to racism, whether they're related to toothbrushing routines. We've got a number of social narratives on our webpage. And of course, our first and foremost frontline folks that we encourage you to contact are our autism resource specialists. They are all the parents of individuals with autism themselves, and they can help to guide you through a variety of different topics and issues, including navigating this challenging time. So we encourage you to go to our website under the Find Help category to learn more about who you can contact within your own region. They're the most amazing resource that we have to offer. So I encourage you to consider them. And in addition to that, within my department, the clinical department, we are offering a rapid response clinical consultation service. It's right now, because we're largely in a telehealth phase, we're able to provide it across the state through telehealth during this COVID time. It can be funded by a variety of different funders, such as the Innovations Waiver under the Specialized Consultative Services definition. It can also be funded through, for example, Medicaid or commercial health insurances, through outpatient therapy codes. And so if you're interested in learning more about this model and whether it might be a good fit, you can reach out to our clinical director, Alec Myers, and you can see his email address is here for you, and he is ready to respond to your emails on this. And of course, finally, our recommended sources of information for COVID-19 are the Centers of Disease Control, and then obviously the North Carolina Department of Health and Human Services. I also want to say that Kristy and my email is at the front of this presentation, and so you are welcome to reach out to us individually, and we can try to support you or direct you to the right resources. So I encourage you to consider that as well.